Hello nurses, let's do another set of NCLEX-RN pharmacology questions. First question is, a patient starting on lisinopril reports a persistent dry cough. What is the most appropriate nursing action? Instruct the patient to increase fluid intake to relieve the cough. No. Advise the patient to stop the medication immediately. Recommend taking the medication with the food to reduce coughing. And fourth option, explain that this is a common side effect and notify the provider. I would go with the fourth option. Correct. Second question, a patient receiving IV vancomycin begins to show flushing and redness of the upper body. What should the nurse do first? Slow the infusion rate, administering an antihistamine before continuing. Notify the provider of suspected anaphylaxis. Stop the infusion permanently. Slow the infusion rate, because you can read through the rationale. Okay. Third question, a patient taking warfarin has an INR of 4.2. What is the nurse's priority action? Prepare to administer protamine sulfate. Encourage the patient to increase vitamin K intake immediately. Administer the scheduled dose as ordered. Hold the next dose and notify the provider. 4.2 is still high. Fourth question, a patient prescribed metformin reports they are scheduled for a CT scan with IV contrast. What instruction is most important? Continue metformin as usual unless symptoms develop. Hold metformin before and 48 hours after the contrast study. Take metformin with extra water on the day of the scan. Double the dose after the scan to maintain glucose control. Second option. Okay, to prevent lactic acidosis. Question number 5. A patient taking a beta blocker reports feeling dizzy when standing. What is the most likely cause? Hypoglycemia, electrolyte imbalance, fluid overload, orthostatic hypotension. Definitely orthostatic hypotension.